Okay. So good afternoon, everyone. Thank you so much for joining us on this Monday afternoon. If you are joining us for the first time, welcome. Thank you for being here to learn more about your mental health. But also, if you are returning from our past webinars, whether mental health or physical health related, thank you so much for coming back and keeping on top of your well-being. So today we have Sasha Latiff-Thomas, who will be presenting on intergenerational trauma. Right? Specifically, the title is Towards Future Healing, Understanding Intergenerational Trauma. As I always say, please feel free to engage with us throughout the webinar, whether you decide to unmute yourself or you're using the chat function, or those watching the recorded version, please feel free to use the comment section and we'll definitely get back to you. Okay, I will leave it to you, Sasha.
Yes. So I really appreciate the warm welcome and the introduction, Cassandra. And I really did want to start this webinar by welcoming everyone who's joining in today. So just a little bit about this presentation. It will focus on understanding and exploring the impact that trauma-related experiences can have across generations and how that can impact mental health and overall well-being. So a bit of a discussion around ways to foster resilience and promote healing will also be covered throughout this presentation and more towards the end of it. But before we really get into it and really begin, I wanted to take a moment to outline today's agenda. So firstly, I will briefly introduce myself, and then we'll take some time to explore trauma, epigenetics, and intergenerational trauma in depth and how these things are connected. Throughout this presentation, I will also be using the short form of intergenerational trauma, which is IGT. I'll also be sharing a few relevant scientific research that supports the evidence for IGT. And we'll also take a few moments to sit with or even reflect on a few impactful quotes that I had found. We'll move into suggestions around cultivating resilience and, of course, promoting healing. And then we'll conclude with having some space for any questions or comments.
Perfect. Before you continue, Sasha, I just remembered I forgot to introduce my own self. So I did. Thank you for saying my name. Yes, I am Cassandra Francis, the founder and clinical director at One Piece Therapy, as well as one of the psychotherapists. So I'm excited to engage here as well. And thank you for my bit of absent mind.
Thank you. Thanks for sharing a little bit about you, Cassandra. I'll just jump into just a little bit about me. Just that I'm a student in my Master's of Counseling Psychology program, completing my placement with One Piece Therapy. So my title is that I am a registered psychotherapist, but qualifying. So at this time, I am supporting clients that are navigating concerns around anxiety, grief and loss, life changes, family dynamics, which actually can all be connected to the topic of this presentation. So just a little bit about why I chose this topic in particular is something that I've noticed is that, you know, a level of pain and trauma has touched every person's life in some way or form. But taking that one step further, the idea that pain and trauma experienced in us may not only be ours to carry, and that's a difficult concept to grasp. So what I mean by that is sometimes unhealed emotional weight can be passed down across generations, starting with our ancestors and all the way to our future great-grandchildren. But before we unpack that idea further, I thought it would be helpful to begin today's presentation by defining and exploring trauma. So what is trauma? So it is the emotional reaction to a terrifying event. Trauma does have levels to consider. So the first one is big T traumas. And those are traumas that are extreme, persuasive, and threaten your safety. So, this is not an exhaustive list, but some examples of big T traumas are things around being abandoned by caretakers or living with parents who don't attend to your physical, emotional, or spiritual needs. Things like having your body boundaries violated, such as through molestation and sexual violence. There's also experiencing extreme forms of punishment, experiencing a serious accident, a natural disaster, a pandemic, witnessing a death. So essentially, what I'm trying to get at is experiencing anything else that has threatened your sense of safety, identity, or well being can be labeled as a big T trauma. Now, little t traumas are also known as subtle traumas, and those are situations that are common, day to day occurrences that cause emotional injury still, but don't usually create a threat to your safety. So, again, some examples could be losing a pet, going through a bad breakup, losing a part of your support system, or a sudden change in your family, or even things like having a part of yourself who you need to hide. And again, essentially experiencing anything else that could be perceived as slightly stressful but does not cause a high level of safety threat could be a little T trauma. But what I really want to emphasize is that people process experiences in different ways. No two people react to the same event in the same way. And what one person experiences as trauma may not cause distress for another.
I also wanted to share here as well how I like to also define little t and big T to clients. I say that little t is more like stress, right? The day-to-day
Yeah,
stress, maybe a certain level of angst in the nervous system, and big T would be considered like PTSD or CPTSD,
yes.
right? So I think that also helps just highlight the spectrum of how severe trauma can be.
Yeah, that's a good point. It's a spectrum. It ranges both very impactful, but the way that they impact and how they hold on is a little bit different. It's different. Like, so there are different types of trauma, and they can take various forms. So acute trauma is a brief level of distress that immediately follows a one-time incident. Chronic trauma is repeated and it's prolonged, and complex trauma arises from repeated, varying, and multiple traumatic events from really there's little to no possibility of escape. But what I do want to emphasize is that emerging trends in psychotherapy in particular have started to point beyond the traumas of the individual to include traumatic events in the family and social history. So now we're sort of moving into things like collective trauma, which can involve a large number of individuals and refers to a shared traumatic event that can be passed down through generations and communities. So this could be through war, genocide, famines, and pandemics. There's historical trauma, so also a level of intergenerational trauma experienced by a specific cultural group that has a history of being systematically oppressed. So these examples include slavery, genocide, colonialism, and forced relocation. And the last one is generational trauma, or also known as intergenerational trauma. And some of those examples are mistrust of people or systems due to oppressive and abusive practices, or having the heightened emotional response due to traumatic events. But we'll get into the description a little bit later in the presentation. So, the effects of trauma. So, I did want to introduce our first quote that I thought was really impactful of the day. And it is trauma is not just an event that took place sometime in the past. It is also the imprint left by that experience on the mind, brain, and body. So, it's quite current. So, a well known and much studied aspect of trauma is the inability to articulate what happens to us. So, not only do we lose our words, but something happens to our memories as well. So, during a traumatic incident, our thought processes can become disorganized. in a way that we truly are not able to remember or recognize the memories belonging to the original traumatic event. Rather, sometimes our memories are scattered into words, images, and bodily sensations that are kept in our unconscious and really can be triggered by anything that even slightly reminds us of that original traumatic event. So, what that means is unconsciously, we could find ourselves reacting to certain people, events, or situation in old familiar ways that echo the past. So, with that being said, us as humans, we all have a bit of a wear and tear meter called an allostatic load. The allostatic load is the total chronic stress that the body accumulates over time. So when stress accumulates without enough repair and rest, it overwhelms this allostatic load. And this in turn depletes the body's capacity to find its own balance. And as a result, it compromises the body's ability to stay healthy. So, really and truly, our bodies and our ancestors' bodies have been in allostatic overload for generations. Carl Jung, who's actually a well-known figure in psychology, believed that we are likely to keep repeating our unconscious pattern until we bring them into the conscious, into awareness. So he really stated that nothing is lost. The pieces have just been rerouted into different parts. So
go ahead.
I was actually going to throw in another quote that I had found that I just found really impactful. And it really is the past is never dead, and it's not even the past.
That's the perfect segue to what I was about to say, because I was thinking about just reading Bessel van der Kolk's quote right here.
Yeah.
There's many times in therapy where clients come in to talk about intergenerational trauma or childhood trauma that was based on the events that occurred then. And we talk about healing and how to get through it, but sometimes, as much as trauma, as this quote states, happened in the past, it can also be present in the future, right? So it's that question, how do I heal when what I experienced then is also occurring now to some degree, right? Even families that have experienced people with addictions, right? Like in the past, that's how trauma started, but how do you heal from that wound when the trauma is existing in present day? Right. So there's so many pieces to trauma in the body, in our own individual lives, and then considering the lineage that we came from, it's really a lot to hold on and in our mind, body, and brain.
Absolutely, because sometimes we're thinking oh, it happened in the past, and we tend to think that, well, it's in the past, the past, it's previous, it's not happening. But what we sometimes tend to forget or even not even realize, honestly, is that it's still very much present with us. It's not lost. Again, it's rerouted and it's showing up in different ways in different parts. And that's where we have to kind of teeter to the past to look at and see how it's clearly affecting the now, the present, the in the moment, the today.
Yes, exactly.
So, with all this information on trauma, I wanted to specifically come into our presentation topic today and explore intergenerational trauma. So, traumatic events affect more than just the individual who experienced it. The psychological and emotional effects of traumatic events can again be passed down through the family. And when this happens, it can often cause intense challenges for future generations. So IGT, it truly is a wound of the soul. It's an emotional injury that impacts a person's mind, so the thoughts and emotions, the body, the way that they carry the suffering physically, and spiritually. So a really heavy disruption in their inner knowing and connection with others. So recent developments in many scientific fields actually have noticed that the importance of exploring at least 3 generations of family history is needed in order to understand the repeated patterns of trauma and suffering. So, with that being said, how does trauma get passed down? So, in his book, It Didn't Start With You by Mark Wolin, um, he noted that the history you share with your family begins before you are even conceived. So, as an unfertilized egg, you already actually share a cellular environment with your mother and grandmother. This means that before your mother was even born, your mother, your grandmother, and the earliest traces of you were all in the same body. So 3 generations were sharing the same biological environment. So when the individual,
Sorry, Sasha. I feel like that just
I
needs a
saw.
moment. Yeah, that I think that just needs a moment to like, whew,
Yeah,
just
yeah,
really breathe through, because that's huge, right? We tend to think of ourselves as, we only exist from when we enter physically in this world, right? Even though I know some tribes in Africa, they consider, they acknowledge the existence of someone while they're in the womb. That's when they
yeah,
count their age. However, in Western society, since this is where we are placed right now, is yeah, we tend to think, okay, when we're birthed, this is who I am, and what happens to me as I'm alive, this is the trauma, this is what I experience, right? But to hear before you even were an embryo,
yeah.
right? You already existed in the body of your maternal lineage. That's so mind blowing to just kind of process and breathe through.
Absolutely. I felt the exact same way sort of going through this process because, again, same thing like you said, I consider myself, as just what has happened to me in this experience, not even really considering my mother, for example, or even my grandmother and how their experience impacts me in a way. It was a lot. And I have one more little add to that because when an individual was a fetus in their mother's womb, they also contain the precursor cells of the sperm from which you originated. So, in either case, science tells us that both the precursor egg and sperm can be imprinted by events with the potential to affect all the future generations. So, it's a lot to sort of sink in. So, therefore, it is believed and researched that the transmission of trauma, again, sort of what we were talking about, through the generations can be passed down through genetic changes to a person's DNA after they experience trauma. So, these effects are called epigenetic changes. So, according to Rachel Yehuda, epigenetic changes prepare us to cope with the traumas that our parents experienced to prepare for similar stressors. So we're essentially born with a specific set of tools to help us survive. And really, this is good news. We're born with like this level of environmental resilience that allows us to adapt to really stressful situations. However, or on the other hand, these inherited adaptations, they can also be a little bit detrimental. So, for example, the child of a parent who lived in a war zone may inherit the impulse to retreat in response to sudden loud noises. We also now know that our genetic blueprint, so the DNA, those epigenetic changes, is only just the starting point. The effects of trauma can be passed down culturally. Right? Over the years, family members may learn unhealthy behaviors, for example, from their parents or other family members. They then imitate those behaviors and eventually teach those behaviors to their children.
Yes, and I think a great example of that is, I think that they call it it's not, is it corporal punishment? Like it's such a like official term
Oh,
when it comes
yeah.
to you like spank your child, right? So culturally, I'm from the Caribbean, Jamaican
Mhm,
descent, right? So it's like,
mhm.
yeah, a part of being disciplined with physical touch, it's it was normalized, right? Just the
Yeah.
culture. If you do something bad, expect to be spanked on your hand, right? Or maybe your butt, right?
Mm-hmm.
But then the blurry line of that is when it can become excessive, right? So what part
Yes.
is like the cultural norm of how you discipline a child versus what part becomes abuse being normalized in a culture, right? When it's excessive beatings.
Mm.
So I think that's a great example because for so long it's like, yeah, yes, you beat a child if they're misbehaving, but then it's like, hey, whoa, what is,
Uh-huh.
what are we actually saying or doing?
Absolutely. And I appreciate you sharing that like that part of you, Cassandra, because yes, as also part of the Caribbean background with Guyanese descent, it's the same thing. Spanking, beating, licks are a part of upbringing in order to discipline and to mold um, the upbringing of a child. But yes, at the same time, it's along the lines of, well, when did this become normalized? When did painful um, hands-on experiences just became a norm? Yes. So this was just a really cool picture, I guess, that really shows a little bit about the intergenerational trauma process that I just spoke about. So there's the trauma piece, right? Various different experiences, slavery, Holocaust, stolen generations, that kind of leads to that biological chemical changes to the DNA, right? And then that's passed on to the second child or the second generation. And then that's also then passed on to the third generation. So passed on from child to child to child. There's also that level of behavior as well, too. Risk of self-harm, addiction, attachment issues, suicide, cancer, again, passed on to the second generation, also passed down to the third generation. So, with that being said, what are the mental health concerns with IGT? And another impactful quote, I thought this one was really great. The parents eat sour grapes, but the children's teeth are set on edge. So, before we explore a bit more about the role that intergenerational trauma plays in our health, it is worth noting that not every family has experienced intergenerational trauma. But because this presentation does focus on those that may have, intergenerational trauma can feel different for every individual. Right? Children born to the same parents in the same family home who share a similar upbringing are likely to inherit different traumas and experience different outcomes. Right? There are really no rules governing how each child is affected. Although, most of us do carry some residue of our family's history, many other factors do influence how deeply rooted we are in our family's traumas. So some of these factors can include, a level of a person's self-awareness, the ability to self-soothe, or just having a powerful internal healing experience. Um, IGT can also feel different in the same person at different stages of life. And additionally, intergenerational trauma does not always involve one big traumatic event. It can happen to families who have experienced prolonged complex traumas or just from one single incident. However, the root of some mental health concerns that are associated with IGT can include anxiety, depression, chronic pain, phobias, obsessive thoughts, and post-traumatic stress disorder, as you mentioned, Cassandra, too. Right? So a person with IGT may experience, really tough feelings of shame, helplessness, and low self-esteem. There may have been negative thoughts or feelings about themselves and the world around them based on the experience they or their loved ones have experienced. So, Dr. David Sack noted that children of a parent struggling with PTSD can sometimes develop their own PTSD, and it's called secondary PTSD. So, about 30% of children with a parent who served in Iraq or Afghanistan who developed PTSD struggle with similar symptoms. So, what Dr. Sack mentioned is that the parent's trauma becomes the child's own, and the child's behavioral and emotional concerns can mirror the children. Research also shows that children with a parent who was traumatized during the Cambodian genocide tend to suffer from depression and anxiety. And similarly, children of the Australian Vietnam War veterans have higher rates of suicide than of the general population.
I just want to chime in here because I really want to bring in our live viewers. I can imagine how much information is being provided, and great information, by the way. Thank you so much, Sasha. But we are also speaking very educationally when these are like really heavy things we're saying. So of course, viewers, if you need a breath, I hope you're taking a breath for yourself. But also, if you have any questions or comments, please feel free to engage as it appears for you. Again, you can raise your hand and unmute yourself, or to write in the chat. I really just want to take a moment here because you're saying so much. I'm like, this is really impactful. So I'm just curious of how our viewers are doing, but please continue.
Absolutely. I definitely am taking a little bit more of an educational, scientific background related to intergenerational trauma, just to really highlight how impactful this has been and how studies, research is really starting to bring along the awareness of how the past is currently impacting us. And it's a lot. So yes, I echo that. Absolutely. There's a big breath that needs to be taken when we start to actually see the research and the quote proof that's coming up behind the now based on the past. I would also like to add, it can be difficult to regulate emotions and manage stress where underlying trauma has been underaddressed, but also present for so long. This is a big study that I found, again, by Rachel Yehuda. She brought awareness to the idea that stress patterns do transfer from pregnant women to their children. She did a research along the lines of women that were pregnant in their second and third trimester who were near or around the World Trade Center during 9/11, who went on to develop PTSD. They actually developed children who had lower levels of cortisol. And our ability to regulate emotions and manage stress are compromised when cortisol levels are low. Intergenerational trauma can also lead to, some unhealthy behaviors, and some of that includes the substance misuse and addiction that we talked about a little bit earlier. Some people may turn to substances and alcohol to cope with unacknowledged, suppressed feelings or underlying trauma. And then these unhealthy cycles may be passed down to other generations. So when I learned a little bit about this, I really considered the Indigenous people in Canada. And I found that Amy Bombay, she is an Ojibwe researcher from the Rainy River First Nation, actually studies intergenerational traumas in Indigenous communities. And I want to quote something from her because she said that often the children and or grandchildren of residential school survivors are at an increased risk of psychological distress, meaning that they are more prone to symptoms of anxiety and depression and substance use, as well as thoughts of suicide and suicide attempts. So one last really quick example is that relationships within a family that has experienced intergenerational trauma may involve those unhealthy attachment styles. And that can cause unhealthy family dynamics that can continue this effect of the trauma. So again, sort of what we're sort of highlighting a little bit of like in the Caribbean community with like the spanking, some family members may follow the same patterns of parents and or grandparents without even realizing that they're echoing those behaviors. A lot of information. There's this quote, again, one must have chaos in oneself to be able to give birth to a dancing star. So really becoming aware of some of these researches, these patterns, these things that are coming up and that's being highlighted. We not only do we need to take a moment for that, but it's actually happening Science is bringing to our attention that these patterns are real, they are available, and it's present. So with all this information that I just mentioned, and knowledge under our belt, we start thinking about, how do we break this cycle of intergenerational trauma? How do we heal, and how do we create a different legacy for ourselves, our family, and our community? So it is up to us to break generational curses. When they say it runs in the family, you tell them this is where it runs out. This quote was so empowering to me. I just felt
Yes.
motivated. I was like, yes, I can do this. I can review. I can understand. I
Yes,
just had to
yes.
put it out there.
Absolutely. There's something spiritual about even how you said it. It's like an amen is like waiting to just, just
Yes,
come out,
yes.
but definitely to celebrate that there can be resilience. So yes.
So, just as a surface level statement, to break IGT, a person really does have to understand the underlying problem, learning how to work through it, and foster ways to prevent and treat the root cause of the problem so that the patterns do not pass onto the next generation. However, I do want to take space because it is incredibly difficult to break a cycle of intergenerational trauma because it is quite deep rooted and it is widespread across multiple parts of a person's life. It can take a lot of patience, time, and effort. And it really is important to keep in mind that healing won't be linear. There will be waves of emotions, there will be highs and lows. So it is natural right now if your heart is feeling heavy, right? Even as you enter this healing journey. But what I really would want to emphasize is that it is possible. Like, it is possible to break these patterns and heal from the trauma that has been present in your family history. And I really do want to say as well, too, that you do not have to do it alone. So let us start with uncovering the underlying problem. So, what does that even mean? Like, how do you uncover this really deep rooted underlying problem? So, it is beneficial to identify and bring into consciousness that intergenerational wounds have troubled your family and that those wounds are currently flowing through you. And again, but how do we do that? So, Dr. Marielle Bouquet, she is this author of this book that I do encourage, anyone to check out if they're really interested in it. It's called Breaking the Cycle, literally a guide to healing intergenerational trauma. And she suggests that bringing awareness and identifying it is really just sitting and recognizing that, the first time when you felt that you were having these intergenerational wounds in your family or in your present. So she had mentioned that the first time may be when you realize that you are reacting to stress and emotional hurt in the same way that your parents do. Or maybe you realize that a large part of your emotional suffering comes from not receiving enough love from your caretakers, and that your caretakers also suffered in the same way. Right? Maybe you heard a story about an ancestor's life and you realized how similar their suffering has been to your own. You notice maybe how hard it is for you to trust both yourself and others in the very same way your parents find it hard to trust, right? Maybe you notice yourself repeating the same harmful language and punishment to your children, right? Or you realize that belonging in a marginalized group has been a source of suffering from your family even before you were born. And again, maybe you realize that you and your lineage have been victimized by institutions for generations. So I really want to say this, whatever your story is, whatever you recognize in your moments, these patterns, hold it close to your heart because it is yours and it is valid. So the next step towards breaking the cycle is gathering information about what has contributed to the cycle in the first place. So again, Dr. Bouquet draws upon a technique used in narrative-based psychotherapy, and it's called tree mapping. So It's sort of a drawing activity, actually. So a person would draw a tree from its roots all the way up to its highest leaf. And pretty much this tree would represent the psychological, the physical, the spiritual, and cultural characteristics of people in your family and as well as your extended community. So by doing this mapping, by mapping, what's happening in the mind, the body, and the spirit, and those internalized cultural messages, we start to gain a clear idea of what trauma may be held in the family unit. So once we kind of have the consciousness, the awareness, how do we work through that? Right? First and foremost, give yourself permission to let go of the past and step out of your history. So all those things that you tree mapped is coming into consciousness, is coming into awareness, but non-judgmentally acknowledging the trauma and its impact on your life is a really big first step. Right? Having and holding these feelings of guilt or shame for some of the things that your experiences can ultimately make symptoms worse. But again, that's easier said than done, to just step out of your shame and step out of your trauma, right? So in order to do this, it is important to expand your intergenerational window of tolerance. So when a memory of the past is unlocked before you've properly healed from it, the experience can cause you to become tense, right? Every person does have a certain capacity to handle difficult emotion. So this window of tolerance that I'm talking about is the emotional space within which you are comfortable and which you feel safe. So expanding that window of tolerance moves you away from triggers and closer to safety, processing, and connection. So really, the idea is to increase your capacity to tolerate this stress that's coming up so that it doesn't get planted into your soul and become a weight you carry around for life. But to do this, it does take daily practice and many repetitions. But in the long term, it is worth it because it'll help your nervous system relax more rapidly and more frequently. So with that being said, our minds do have a great capacity for healing through images, right? Whether we're imagining a sense of forgiveness or comfort in ourselves, or simply visualizing a loved one, images can settle into our body. So there are ghosts that can go from haunting us to simply becoming part of our history. One key way to do this is by allowing ourselves to be moved by an experience or an image strong enough to overshadow the old trauma, emotions, and sensations that live inside of us. Um, Dr. Dawson Church also describes how visualization, meditation, and just focusing on positive thoughts, emotions, and prayers, if that's relevant to you, or what he calls epigenetic interventions, can actually activate genes that positively affect our health. So, filling our minds with positive images of well being, he says, can produce an epigenetic environment that reinforces this healing process that we're going towards. And research has been dedicated to showing how meditation, for example, can positively affect gene expression. So not only is it helping you in the moment, but it's actually doing something to your genetic code, like it's modifying your genetics. And again, as we talked about earlier, there's that genetic components to intergenerational trauma. So as you start to begin to change potentially your genetic blueprint, some changes, some healing, some cycle breaking is actually occurring.
And I do want to chime in here because it's because we're talking about heavy things, right? A heavy topic, heavy examples. It can feel like it's hard to get there. Like, how do you get through what simple things when we're talking about something so complex that we exist in our mom's womb, our mom's womb? Like
Yeah.
how does breathing help all of that? And I think it's just so important. What we don't design ourselves, like how the body's created, but what we do know is that it really does take simple things in the body to heal. So as long as we're consistently engaging in it, right? Breathing gives us a life. As simple as it is, this is what keeps you living in a very complex way. So often when we talk about life as existentialism, healing, trauma,
Mm.
the complexity and the simplicity often get paired together. And as you're saying, images, meditation, right? Focusing on positive thoughts, like it is really true. And I'm just reiterating what you're saying, because again, it can be like, how is this going to help? You
Yeah.
know, people might question prayers. Like, how is this going to help
Yes.
something that is way beyond me? And again, it is so possible. The body is designed to heal itself, right? So when we use the resources that gives our body space to heal itself, literally anything is possible.
Absolutely. Oh, absolutely. And that's why I really wanted to draw on things that might feel a little bit easier because, of course, this is very different for everyone, right? Prayers may work for one person, it might not resonate for another, but maybe meditation does, right? Positive thinking, okay, we can think positive, but maybe we need a little support through like affirmations, for example, right? It's about finding something that really is unique to you that would bring in a little bit more positivity into your life. And once we have that little glimmer of hope and that little glimmer of positivity, now it's just about building a routine. Right? The mind, the body is routine based. We're able to pull on that. We keep doing it consistently, might not seem like anything right now or in this moment or even maybe a week from now, but in the long run, we're knowing you're making changes not only for yourself but for your futures, for your lineage. It's a lot. It's good work. It's exciting work because I got royalty inside my DNA.
So we just here just so
What's inside our DNA? We really do. Now,
why not
tapping
quote Kendrick
into that,
Lamar?
people stating facts. I must bring it here. So, like Kendrick Lamar was trying to emphasize, human beings are resilient and are very capable of healing most types of trauma. And this can happen at any times in our life. So, drawing again on Dr. Bouquet, she suggests that disrupting patterns can be done by existing again as a more healed self, right? How to do that, having conversation about IGT is can be something to start doing, to start incorporating, to start voicing out loud. We have a little bit of knowledge, now voicing it to others, to ourselves. Journaling can be really helpful. However, I would say give yourself permission to move on alone if you do know that in your heart these conversations can lead to more pain, right? But if you feel that you would like to introduce your family members, for example, to these topics, tools for navigating these difficult conversations are needed, but it is possible, right? Providing yourself with what you needed but didn't get as a child could help soothe your inner child, repair that insecure attachment, and develop a healthier relationship. But how? We could start by reflecting on what was needed as a child but didn't get, then offering these moments to ourselves in the present. So, as I mentioned before, reciting affirmations that you wish you heard as a child is an option, such as you're worthy of love, right? Sometimes that could include recreating a childhood memory, like watching one of your favorite movies from childhood, right? So anything that you found unique to your childhood could be used when, starting to treat the root cause of the trauma. There's also a level of shedding the pain that Dr. Bouquet had mentioned that will pave a way for healing. She mentions that shedding this expectation of who your family could have been, right? All the ideas that who you thought you were and the perceptions of the world around you opens the door to a new reality, right? And that reality could be one where you see things for what they really are. They are hurtful, but they are very survivable, right? And this is a painful process. This is a grieving process. Allowing, yourself to grieve will help shed that pain, right? And there's also breaking up with shame, right? So shame again is a very complex emotion. It is the idea that you are bad, you are broken, you are inadequate, and that causes painful feelings of humiliation and distress. Children especially take on their parents' shame because they're accessible targets to displace that shame onto. you may have potentially become like an intergenerational bearer of shame and grief. Now, increasing your generational resilience will require that you push yourself in that direction of growth, right? Intergenerational resilience really refers to the endurance, the strength, the healing, the adaptation of the people that we descend from, right? And the ways in which in our lifetime we have built upon their strengths to succeed in our own circumstances. So just as much as there's trauma in us from our lineage, there's healing and resilience from that same lineage, because it was there, it was present. It's just about tapping into that, getting familiar with it, understanding it, and then moving forward with it. So earlier in this presentation, I did mention that you do not have to break the cycle alone. You do not have to treat the root cause on your own, work through the intergenerational trauma again on your own. Building and fostering safer social connections often offers that connection towards healing, right? But that is a challenging task, and it requires a level of vulnerability and trust in others. So to gain insight on IGT, process the pain and grief from the trauma to create an authentic, connected identity at like your own pace and your safety, professional support through a psychotherapist, for example, can be incredibly helpful. Some approaches that I personally find helpful to foster this journey as what I would call a cycle breaker, as well as to process thoughts, emotion, and trauma that comes with intergenerational healing, are things like narrative therapy, solution focus, brief therapy, or body somatic therapy. Right? I personally draw on these approaches in an integrative, a very holistic, trauma focused, and culturally sensitive way, which also, Cassandra, aligns with One Piece Therapy's mission. In different ways, the techniques used in these approaches, they really ask to start that conversation about describing your experiences and emotions around family dynamics that you're noticing and the trauma that you may have experienced, right? Once we kind of start identifying these unhealthy thoughts, these behaviors, these pent up emotions, in the body, it may surface if we start working through these things, right? These approaches can also then support building a unique identity, right? Applicable strategies to manage and modify the range of these experiences from the past all the way up until the future, right? Ideally, what we would want from this experience is not only to get to the root cause of this trauma, but to build a new relationship, not only with yourself and your others, right? And a new identity. And, a preferred future is collaborated upon, and the process has started. So with all of this being said, this is, the end of the information portion of the webinar today. And I really appreciate and thank everyone for joining in.
Thank you so much, Sasha. Like so much for handling such a heavy discussion with light and compassion with the information shared. I know someone commented in our chat that it's a lovely presentation. So thank you for your feedback. You shared a lot, and I think, with all that was shared at the end of the day, I really hope everyone can take away that it is still possible, right? It's still possible to heal, even if someone is genetically predisposed to something or environmentally exposed to a stressor or trauma. It is always possible to heal and change your narrative, right? And again, it is also challenging to do so, right? Whether you do it alone or not, it is a challenging process that does have ups and downs. And as Sasha just mentioned as well, she is supporting clients on their journey of healing through intergenerational trauma. So please feel free to reach out to One Piece Therapy. Our information is where you signed up to view, or if you're watching the recorded version, it's in our description. And we'll be happy to set you up and schedule an appointment with Sasha to begin your journey. And so someone mentioned as well, the comments are coming in. They said, thank you, lots of beneficial info that I didn't even know or consider. Yes, very insightful. Again, the conversation does not have to end here. We can definitely schedule an appointment with Sasha to continue your healing. But thank you everyone for taking the time, being present, and we're glad to know that a couple of you, hopefully all of you watching, really have taken away something. Have a very good evening, day, week, month, and we will see you in our next event. Take care.
Thank you. Take care. Thank you, everyone.